So here we are having question number 4. As in the previous video you have watched that the 3 questions of the Krok 1 2021 have it covered. Here the fourth question says that eubiotic colicin is used for the disease treatment and prevention. This protein suppresses the growth factor of pathogenic microorganisms. Colicins can be synthesized in the intestine by non-pathogenic bacilli. What structure codes the ability of bacterial cell to synthesize colicin? First of all, if you see the question, that colicin have been given every time, and the question is asking that what structure, if you see here, that what structure code the ability of bacterial cell. It's talking about bacteria, right? So, and it's also given here that can be synthesized by the in the intestine by non-pathogenic bacilli. It is also bacteria. So, what the point? Which point you have to keep in mind that it is talking about which organisms? That is bacteria. Bacteria is prokaryotic. If you remember that two kind of organisms, one is eukaryotic, like we, animal and plants. Prokaryotes, they are not having the true nucleus. Prokaryotes best examples are the bacteria, or you can say bacteria also known as prokaryotes. Prokaryotes have the nucleoid, okay, in case of, because it's their basic feature that in prokaryotes nucleus absent and it only present in eukaryote. So your this option is going to be incorrect. Okay, now other things, when we talk about other things, okay, here easily you can see that all other options present in the some prokaryotes and eukaryotes. Okay, in 4, which one is supposed to be correct one? Here we are talking that name itself says that this protein, so what is the nature? Its nature is proteinaceous nature, colicin. So if you remember that eukaryotes have the protein synthesis, or protein protein formed by the ribosomes, rough endoplasmic reticulum. There they form the protein with the help of rough, because they are present of ribosome. If you remember the basic mechanism. In case of bacteria, it's very interestingly that there is similar organelles present, which is plasmid. So simply here the plasmid having that possibilities to produce the proteinaceous molecule in the bacteria. Now ribosome itself don't have possibility to synthesize or produce. Actually they act as apparatus, but they are not producer. Nucleoid, simply they will generate the nuclear material, and mesosome, it is similar to the mitochondria in the eukaryotes. So the answer is going to be the plasmid. Now moving toward the next question. Next question says that a patient is suspected to have typhoid fever, and for 2 weeks no laboratory diagnosis was made. For 2 weeks no laboratory diagnosis was made. So before, let me read, and then I will tell you the way to solve. The question says that a patient a patient is suspected to have the typhoid fever. For 2 weeks no laboratory diagnosis was made, and what material must be sent to the laboratory for the bacteriological analysis during the 3rd week after the onset of disease. So here disease is typhoid fever. After, for 2 weeks no material was taken, and after 3rd week, okay, so in the 3rd week means it is simply 3 weeks, it is 21 days. Now before going to this description, I would like to tell you the simple pathophysiology of the typhoid. Pathophysiology of typhoid. Now what happened, that as you know that it is the transmission. Here I am writing down that typhoid transmission is fecal oral. Causing organisms is Salmonella typhi. Confirmatory test is Vidal. Okay, these 3 points from the previous section or any kind, whenever you study the typhoid, that moment you know. Okay, now let's talk about the pathophysiology. One step ahead. In pathophysiology section, that a person ingest the contaminated food, so it is ingestion. The next stage, that ingested of like bacterial, which is having contamination. The next is that ingested bacilli invade small intestine mucosa part, ingested, taken up by the macrophages and transported into the regional lymph node. Okay, so in the small intestine there is like if you remember that there is absorption take place, so here it goes through the lymph node, through the lymph to the lymph node, and in the lymph node there Salmonella typhi multiply in the intestinal lymph tissue and taken up to the enterocytes by the macrophages cells like a pear patches, and they cause the symptoms of the diarrhea. Later, end of incubation period, it goes to the onset of typhoid fever. Okay, and bacteria invade the blood. I mean, it goes to the from lymph, then later next stage is blood. Then next one, it goes to the gallbladder, lymph tissue of the bowel. Okay, and then again it comes to the small intestine, large intestine, then stool. Now the very important thing you should keep in mind, what is the period, or simply how to remember that those days where the infection is really having the you can say having the particular effect over the body. Now going through the particularly Salmonella typhi, here I want to give you one trick to solve all bacteria type of this kind of question you will get everywhere easily. So how you should solve that, those bacteria who have their probability to transport through the fecal oral transmission, so simply means they can be transmitted through the water, food, or any kind of material, and they go through the GIT tract of small intestine. Here, when bacteria, let us assume this is bacteria, when it attached with the small intestine, initial phase it take 12 hours. When this bacteria attached with the only mucosal area, here I talk lymph system, it take 24 hours, rough figure. When this bacteria read into blood, that is 2 days. In the last, when this bacteria reach to the organ, it is 3 to 5 days. So how you can get the confirmatory things? In initial 12 hour, if you are taking blood sample, so that simply means your diagnosis will be the negative. If you are taking blood lymph sample in the 3rd day or 5th day, it is also going to be negative. That simply means that the most accurate form is your blood. but blood have different kinds of test also. Okay, like they will be CBC, but they're not going to give the confirmatory report. So here you go for the like tissue biopsy or some kinds of other kind of test. So here blood is supposed to be the standard margin or standard diagnostic tool to examine that the particular person is having that kind of infection or not. Okay, so let's come back to the question. In the question it was given that patient is having which kind of infection, that is typhoid, and it is third week bacterial third week bacteriological analysis. So which material should be sent? Simply it's not like kind of viral infection. So what are those options which can't be in the answer? Okay, it is a fecal oral transmission firstly. Okay, so in this case there, this is not going to be the answer. Sputum is not going to be the answer. Okay, nasal mucus is not going to be the answer. Now what is the next thing which is supposed to be the taken? The two option left, because it is a fecal oral transmission. Either it can be gastric or it can be feces and urine. Third week means it is 21 days. So if you use your little bit sense, then you will get the answer that feces, one, urine. Only mainly feces is going to be the answer. But why not gastric? In gastric there will be a gastric lavage water. There may be probability that these bacteria can be simply dissolved by the gastric higher acidic content environment, or it is not a simple technique. So the most accurate answer is going to be the feces. Okay, now let's go to the next question. Next question says that there is a blood test shows low hemoglobin level. What function of the blood will be disturbed in this case? Now low hemoglobin content and its function. One word answer. Those who know, you are going to give the answer in one shot. But let me explain you that question is asking about low hemoglobin and its function. So simply what happened that you have blood have three main things: formed element, plasma, and others. Formed element and plasma is around 70%. Okay, so in blood, formed elements have further two subdivisions. They may be either RBC or WBC. In WBC they have further two divisions: agranulocytes and granulocytes. In granulocytes they have further three things: basophils, eosinophils, and neutrophils. In case of agranulocytes they have lymphocytes and monocytes. Lymphocytes are two types: T lymphocytes and B lymphocytes. So simply this is a whole hematology which is going to be work while you study these things. Now they have the separate function, right? When we talk about the plasma material or something, okay, here we will be focused on the hemoglobin. Hemoglobin is formed of two component, heme plus globulin. Heme part is iron containing. Okay, their main function everyone knows: to transport gas. Which kind of gas? That is oxygen. Now one hemoglobin molecule transport 4 oxygen molecule. Okay, So in the question section, when you see that what I recommend you to remember every time, like coagulability every time is associated with the thrombocyte or vitamin K. Sorry. Immune maintenance is always most of the time or mostly maintained by the lymphatic tissue, lymphatic cells means this kind. Okay, and they are basically from the T cells or natural killer cells. Nutrient transport is the function of plasma. Hormone transport is a function of plasma. So only one is remaining, that is gas transport. Okay, these 5 words having the 5 concepts. Now the next one is this. The question says that a 55-year-old man was examined by the endocrinologist because of the disturbance in the pancreatic endocrine function. What disturbance manifests the decrease in blood glucagon level, and what cells of this gland do not function? The question is talking about pancreatic function. Okay, blood glucagon level, and it is again talking about what function of this gland. So here we have like pancreas, our main organ, blood glucagon is a second. This question was supposed to be the tricky one because every time whenever you solve the question or the previous question if you solve, then they were strictly based on the glucose or insulin. Okay, and the most of the time answer was the beta cells. Now this question is the little bit different. How? If you only mug up the keywords, then this question 90% of the chance you will do the wrong. But how you can use, like pancreas having two functions. Actually, if you go through pancreas, pancreas is a mixed gland. Now mixed means they have two functions, endo and exo. Also, pancreas is supposed to be very important gland for the regulation of very important thing in our body, that is glucose. Most of the time the person suffer from diabetes. So in this case, this is the major function. But what you should not ignore, not only glucose, what it how it means how pancreas regulate the glucose by insulin producing. What it do? It simply decrease the blood glucose amount. It also increase the glucose amount by glucagon. And the third one, which I'm not telling here because you might get confused, so only remember these things. Now insulins and glucagons are secreted by the different kind of cells and they have the different name, like insulin from beta cell, glucagon from alpha cells. By these things you will be able to solve this answer, that answer is alpha cell. But what I mean to tell you, here is the question, how actually to crack this question. Disturbance manifests as the decreased blood glucagon level. It is not saying glucose, okay? It's not glucose. It is a glucagon. Here you will get confused. Glucagon is different, glucose is different. Glucagon is hormone produced by the alpha cells and insulin produced by the beta cell. And what they do, They simply, like what insulin do, insulin have capacity to reduce blood glucose, and it act antagonist to insulin. Like glucagon have capacity to increase blood, like this one is decrease, this one is increase blood glucose. So in this case, that decrease blood glucagon level, that simply means if glucagon level is decreased, okay, so blood glucose level will not increase. Okay, don't take it as a healthy one, because blood glucose level will not increase, that simply means you think it is not diabetic condition. Actually you need glucose molecule to perform the normal function. So it is also pathological condition. Like you can correlate that term, like your brain also needs glucose molecule to produce energy. If you remember that glucose molecule, they produce 2 pyruvic acid in the glycolysis, and result is the formation of energy. Also there is, if you remember, that many intermediate compound form, as I told you, as I taught you in my class. So here what you have to remember, that increase or decrease both are pathological. Okay, if it is normal given, then it is okay, otherwise it is always pathological. Now let's go to the next question. This question says that a man suffered sorry okay a man has suffered recurrent intramural myocardial infarction. After a course of treatment and rehabilitation, he was discharged from the hospital in a satisfactory condition and registered for a regular checkup with his therapist. 2 years later, he died in a car accident. And what type of the pathological process was detected in the myocardium during the autopsy? Now, what you have to keep in mind, that a man has suffered from intramural myocardial infarction. After a course of treatment and rehabilitation, he was discharged from the uh, hospital, satisfactory condition, registered for the regular checkup and therapist. 2 years later, 2 years later, died in a car accident. So, what kind of changes, process, pathological process detected in the myocardium? One thing what you have to keep in mind, that it is talking about has suffered means 2 years before, so the condition is more than 2 years, so it is a chronic. Obviously, it is chronic condition. Myocardial infarction is not a reversible. MI is a irreversible. Changes in heart cell. So the question is that what may be observed in case of this pathological condition in heart. Now it is very important for you to know the basic pathological definition and what does it mean. Okay, myocardial infarction is given here, as I taught you in my class, just giving you a revision here, that they may have different kind of origin, right? Myocardial infarction, they may present the first one, that is intramural or transmural, or they may present subendocardial or non-transmural, or the last one, very important, that they may present in multifocal form. Okay, so here it is saying that what does it mean that there is intramural problem. See guys, that we have heart. Okay, this part. Now let me tell you that I'm talking about this part only. It's left ventricle. This you can assume as a wall of heart. Okay, now if you go in more detail, okay, let me cut this part only, so it will be like this part. Okay, now what is transmural, or you can say here in the question it is saying intramural. So intramural means that inside, so this part is defected. It's left ventricle, this part is defected, means here if I zoom in, so it is like this part. So now I think it is clear for you. I use black color, means there is cell death while going through the myocardial infarction. Okay, so cell death itself is like a necrosis, or you can simply assume that whenever there is intramural myocardial infarction, their inner wall of left ventricle or the heart chamber may be infected. So here the answer is necrosis. Okay, it may be present in a small amount or localized amount, but it will present because it's more than 2 years. It's already having, that person is already having a problem in her, that is intramural myocardial infarction. Now why not others? Okay, if you have some idea in the first section of the class, see, myocardial infarction post infarction may result in the cardiosclerosis. In this case, what happened in cardiosclerosis? Simply, I'm talking about cardiosclerosis. What happened exactly? It may be result after. It always result after MI. And what happened? That there is a replacement, or you can say it is a post infarction cardiosclerosis result of the myocardial infarction. Necrotizing heart muscle region replaced by the connective tissue. There is replaced by the connective tissue. Okay, and also it support the other part of heart, but it will be post infarction, but that person was getting treatment, so it is going to be the like it says that there is what type of the pathological process was detected. Okay, now this answer was given over the other sections, like if you solve like sorry to say, but like Kharkiv and other exams, they have given the answer. It is as a large focal, and one have given it as a small focal. Why I don't favor this answer? Because in the question itself, it has been given clearly that there in course of treatment, when treatment was given, then why the post infarction stage will come? Simply, when a person is getting a proper treatment, then why the post infarction stage will come? And this case is the identification of the post, like sclerosis itself, like this and this, they are the post infarction, after infarction, but so that person is already having that kind of treatment. Why not atrophy and hyperplasia? Atrophy is somehow when there is degeneration of the functioning or circulating tissue or the cell. And why not at hyperplasia, increase in cell number, there's no sense to tell this thing, because that person is having chronic disease, myocardial infarction, and there will be why there will be the increased number of the heart, or also these cells are the permanent type, right? So from next question onwards, we will meet in the next video.